Hi, I am Dr. Suvarchala, the Scientific Director with Ziva Fertility Centers. More often than not, when we recommend or suggest IVF to patients, there is a fear of the unknown. The medications, the whole procedure per se, embryo transfer, the complications, the side effects of these medications. So, one of the biggest fears in patients that we have observed is the procedure, the operation theatre procedure that is involved in the whole gamut of this treatment. What happens basically is that you are given medications for 10 days, and once the proper size of the eggs is achieved, we take you into the operation theatre, anesthetize you for about 15 minutes, and a very thin needle is passed into your ovaries. I wanted to show you the needle as well. Just look at this, how thin it is. It's as thin as a pen's nib. It's long, yes, but it goes from the vagina into the ovaries directly, so it does not damage your endometrium or your stomach like people ask us, cause a hole, or doesn't need a suture, doesn't need for us to cut open your stomach or your uterus or anything. We just pass this into the ovary, and with a suction pump, it's like draining the follicle. So the follicle is like a ball full of water. So we're trying to drain that, which also has the egg, and pass it on to the lab. So that's a very simple procedure, and all of this is not done blindly. It is done under ultrasonography. So the fertility specialist knows very well where she is going. She is under the guidance of the ultrasonograph, and there is no chance of missing in good hands. So she goes into the follicle, gets the fluid out and passes it on. It's a procedure of 15 minutes, and in good hands, even if the follicle numbers are more, if the eggs that are expected are more, the procedure will not be crossing about 30 minutes. The anesthesia is a very short anesthesia. You are out of this anesthesia as soon as the procedure is over. You are shifted out of the operation theatre into the recovery room. You lie down there for about 2 to 3 hours. If you are able to drink water and not throw up, it is indicative that the effect of the anesthesia has come down, and we allow you to go back home. It's a very simple procedure, like I said, and the post-operative complications or precautions are also very few. If you are being prepared for the embryo transfer in the same cycle, we will ask you to take medications for that. If not, a few painkillers for that day. You are not going to be bleeding. There's just going to be a little bit of soreness, so we'll put you on a little bit of painkillers for a couple of days and send you back home. You are allowed to eat anything you want from that evening itself. Just go back to work. Many women go back to work the very next day itself. So this is a very simple procedure. If the fear of the unknown is what is stopping you from going for IVF, do not hesitate to talk to us. You can see numbers on your screen. You can drop a comment in the comment section. Take an appointment, come down, meet us, talk about it. Do not delay the procedure. Do not hesitate from availing this technology, which will give you a very good success rate with pregnancy. Thank you so much.